one more online and then we'll go to the ones in the room. Given the reported adaptation of pertussis to vaccines, what do you see as the future approach? That's a big question.
Well, my response is that we need better vaccines. That the concern we've had when we've gone from wholecellular, which were causing lots of reactions, the acellular isn't as good. And as already mentioned, there's a few new vaccines coming through. There's probably going to be a standalone whooping cough vaccine, which when it's available, I think in Thailand and Singapore, if that comes to Australia, then being offering it. So if it's a better vaccine, I think that's a chance to maybe influence it. So I guess while we've got essentially substandard vaccines, then there's still a challenge to how to manage whooping cough.
Okay, John? Oh, sorry.
Thank you. Sarah McGuinness, Adult Infectious Diseases Specialist in Melbourne. I guess my question is that at the moment we're seeing greater choice for people in terms of the vaccines that are available, and not all of them are on the nip. And acknowledging that the coverage problem is one thing, we have a lot of well-informed families who are now interested in what additional benefit might they get, for instance, from new pneumococcal conjugate vaccines or from RSV vaccines. So I'm interested in how you navigate that conversation and what perhaps the incremental benefits might be, and how do we kind of weigh that discussion up of a funded vaccine versus a vaccine they can buy in the private market?
When in my clinic, I show them obviously the National Immunisation Programme, and I also show them the private programme and explain to them about the costs. You know, things like meningococcal ACWY when they're little, you know, under 12 months, and explain to them about the benefits. A lot of them that come to my practice have been referred by paediatricians who have gone through the private vaccinations as well. But I feel we need to be more open with families about private vaccines, so such as the second varicella vaccination. You know, you talk to most of the nurses in private care and all their children have had second chickenpox because they're aware, and a lot of parents aren't aware. So I think we have to be more open with private vaccines and not assume they're not going to do the vaccine because of the cost.
And can I add to that I'd encourage the federal government to not be shy about the vaccines that are recommended by TAGI but not funded. And Australia's, I think, got a huge complex around that if there's a TAGI, so an expert group recommending a vaccine, but it's not actually funded. I understand the politics where the politicians are saying don't embarrass us by talking about it, but I think Australia's going to open itself up, and maybe the government might actually save money if they can openly talk about the recommended but not funded. There's about 6 that most of us think are appropriate to be recommended. More are coming on that aren't funded, and I think we should have an equal conversation and see them as equal quality or in their true perspective, rather than they can't be that good because they're not funded.
Okay, John?
Just as a comment to that, Rod, I have a separate question. I had a look at the history of vaccines, and vaccines for adults and older people have about a 5 to 10 year lag behind paediatric vaccines from the time of their availability to the time they actually get onto the NIP. So we do seem to have a bit of a discrimination between older people and younger people. My question is to Catherine. There seems to be a sea change in the role of healthcare providers' influence on getting vaccinated. 1998, I did the first national influenza and pneumococcal survey, about 4,500 people. The prime mover of vaccinations were the healthcare recommendations. And in a multi-level analysis, the odds ratio for that was 10 times, not 1.7. It was about 20 times for pneumococcal, and then 10 years later when I did the national zoster study and looked similarly what were the factors, the impact of a healthcare recommendation was about tenfold. One of the differences between the surveys that I was involved in and what you're suggesting is that yours involved adults from the age of 18. I looked for over the 65s, but that's a huge difference. So there's a possible interpretation is that healthcare practitioners in some way are losing their influence in having a recommendation. So I'd be interested in your comments on that, about whether that recommendation is still holding. I believe it still holds for older people, but it might be that in the survey that you've got, which is perhaps more adults and younger adults, is that they don't see the healthcare practitioners having such an impact, and there are a lot of reasons why that might be.
I agree. I think it's a complex issue. I think COVID-19 had a massive influence on trust. It made all our lives a lot harder. I also think we obviously live in a very busy world, and especially parents going to GP medical centres is not necessarily going to the same GP each time. So that trust with their healthcare professional is not as high as it used to be. I would agree that the over 65s are more likely to have vaccines because they've been to the same practice for many, many years. They know the same doctors and so forth. I think it all comes down to we live in a very busy world. I think social media has a massive implication as well in what's happening with the media. So I think there's a lot of layers to that. I think it's really important to have a relationship with a healthcare professional that you trust. I think that's the one person that you go to and you really listen to what they say and take on board. I think that's a problem, especially in lots of areas. Metropolitan land, life's busy, parents, don't go to a GP, but they may just go to lots of different GPs.
To be a little bit provocative about that, continuity of care often exists between a GP and an individual parent or it's less likely. You might have continuity of process at a pharmacist or the sort of clinics you're running in the Barossa, which actually sort of meet a service thing because of the demands on GPs. But one of the key things that undermines trust is the lack of continuity. You actually need time for both parties to kind of understand and appreciate the other person's viewpoint.
I totally agree. I think we're finding that even more in rural land where we're having a problem with GPs. We're having interns that are moving on regularly. And I can see that in our medical centres that where I work with, that they don't know their doctors. So they're not likely to take on board what they say. They want to go somebody who they recognise and know, and also as part of the local community. That's a big thing in rural community as well.
Yeah, John, can I just add to the... I think the immunisation program in Australia fixed the easy part of our program, which is children's vaccine, easier than, I think, adults. I like to contemplate the difference. If you take three people of the same age, so Pauline Hanson, Gail Waterhouse and Malcolm Turnbull, all of the same age, but you approach them to talk to them about their vaccines and what's the best vaccines for them, the actual history, the complexities of talking it to different people. But if you approached Pauline Hanson and tried to tell her she needs to buy RSV vaccines, you wonder if the answer is going to be different. Gail Waterhouse has probably had tetanus injections every year, every time she's touched a horse. And Malcolm Turnbull won't be put off by the cost of it, but he may have a different argument and talk about his relationship with Trump or something. But I think adult vaccination programs are more complex, part of the reason, but I also think the paediatricians saw an opportunity, and I think Australia's done a fantastic job in vaccinating children. We went from 55% to 90% in the 90s, as you know. By the turn of the century, we had 95 plus, or around 95% of childhood vaccines. The government then pulled the funding, and this is a warning to the providers now. The government pulled the funding for general practice because they said, well, we've got 90% vaccination rates, so they pulled the funding for GPs. It was $18 per vaccine. I think it's good they've got incentives for pharmacy. They're about to pull I think 1st of July, the vaccine incentive for COVID is going to go from general practice. So it's amazing how everyone's really excited to say, oh, here's a fantastic program, we'll support the providers, make sure they're properly trained. All of that's important. But when you pull the funding, people don't have the time or resources to invest in it, so the programs fall off. I'm surprised that the politicians are surprised that their programs are declining when they're not investing in it.
Okay.
Thank you. I work as an authorised nurse immuniser and an RN I'm from Tasmania, and thank you very much for this opportunity to come to this forum. This is more of a comment. I wanted to respond to the comment voicing concern about nurse immuniser training. I think there's quite a number of nurse immunisers here today, and as a professional group, I can assure the forum that our ongoing training is not restricted to online, and we do keep up our training and keep up with the vaccines. And this kind of forum gives us an opportunity to do just that as well. So thank you very much.
And Immunisation Coalition, thank you, has taken a position that a properly trained provider is appropriate. We've always said that they need access to people's notes. We're pleased that you can report to the Australian Immunisation Register, because that's important that you've got access to the history and other people can see what you've been doing. But it's always been a policy of the Immunisation Coalition to make sure anyone giving a vaccine has to be able to do it safely and properly in the proper circumstances, and I think we all agree to that. It's about the ongoing support of that and recognition of it. But the challenge at the moment is we've got more providers than we've ever had. We've got more highly qualified and we know safe providers, but we're getting falling vaccination rates. So there's two parts of that. One is that we need to keep supporting you to do it. The second thing is that we actually need to make sure that we actually get an opportunity to turn it into some functional reality where our vaccination rates are as high, deserving the recognition and the skill set that you offer.
And funding nurses in GP settings.
Well, and I think my comment was generally is that it's the funding for whoever's doing the providing, and the local government will tell you were underfunded when GPs were first given $18 for an injection back in '96. The local government said they weren't getting their funding and they complained about GPs getting it. So I don't think it should be a turf war between someone getting funding. I think anyone who's going to do vaccinations need to be properly funded. Otherwise, why are you surprised when the vaccination rates drop off?
Great, thank you.
I'd just like to comment. So thank you for that comment. I agree. This is a healthcare professional. It's not a GP, doctors, pharmacists. We need to work all together. I would say in rural land, where I practice, the nurses are the mainstay in general practice because unfortunately, like I mentioned, our GPs, we can't get enough GPs. We have interns that move on. So quite often that message to patients about vaccinations and trust comes from the nurse that they've known for many years. So yeah, but I don't think we need to get into a kind of is it a GP, pharmacist, nurse role? We all need to support each other and help. And I agree, I feel funding should be equal. Who gives the vaccine, who's trained, who gives the vaccine gets the funding. So thank you.
Question?
Hi, my name's Kylie. I'm from Far North Queensland. Just wondering if you had any thoughts about improving equity of vaccinations in communities where they only have access to S100 medications, so none of the private vaccines.
Just while thinking about that, we've discussed it at morning tea. I was talking to a few people about who's getting vaccines. It's important that as providers we know where other funding comes from. Sometimes the states will fund it. The introduction of the new RSV vaccines, the states are funding, I think, the childhood one, and the Commonwealth is doing it, so there's integrating. The Department of Veteran Affairs will pay for any veteran who's appropriate, so an authority prescription will do it. We talked about some health funds in South Australia who I don't think interstate, and I don't know, but will sometimes fund vaccines. So it's not only about funding it from the government, it's actually lots of other sources, and part of the trick as a provider, I think, and certainly in general practice, you look at ways of getting funding, but I think you've got to be careful that doesn't take away from the fact that you need to tell people what vaccines are available and they can take part in it. And as was mentioned earlier, Michael's giving his parents their RSV vaccine, I think, or himself. Other people in the family will step up. You put a proposal to a young family, you think they're not going to afford it because they're spending all their money on cigarettes, and grandma says, I'll pay for this Men B vaccine or something like that. So I think it's important that we've got to have both in mind. We've got to understand where funding comes from, what are the channels, but you also understand the patients need to understand, the people need to understand these are the vaccines that are available. Have a think about how you can access it, not for us as a health clinician to make a decision. This person won't make a decision or won't afford it.
Does that answer your question? Is it in regards to funding, or is it?
No, not at all.
Is it to do with access?
Access, yeah.
So is it to do with prescribing the vaccines,
so the
or
areas
actually
that I work
getting
in
it in the
is
fridge?
remote, so that they're prescribing, yes, but also getting the vaccine to those areas is an issue. Like, we can really only get NIP vaccines with cold chain issues to the remote areas that I work in. it's very difficult. We have a lot of cold chain issues if we get private vaccines
Yep.
from pharmacies from urban areas.
Have you been in touch with wholesalers of private vaccines? And it's a difficult, yeah. So obviously this is an issue worldwide in remoter areas throughout the country. There's lots of initiative things they're doing. But yeah, I don't know if I can answer that question. In regards to prescribing, obviously there is a prescribing course now nurses can undertake, and obviously nurse practitioners can prescribe as well, and they potentially could do that remotely. It's just actually getting the vaccines in the fridge. So that's a pharmaceutical wholesaler issue about logistics of getting
And
it there.
probably cost is an issue in
Yeah.
Aboriginal and Torres Strait
Yeah.
Islander communities too.
Yeah.
Okay. And we'll have just one last question from the...
It's actually offline because one of my nurse practitioners from Limestone Coast couldn't text you, so she's texted me instead, and she's listening to this. So this is from Gail. Why can't nurse practitioners and nurse immunisers have access to provide vaccine clinics? There's no need to have doctors to oversee provision of care. As already stated, nurses are the mainstays and very much UTD. What's that?
Today.
Up to date, thank you.
Yeah, I guess trying not to make it a turf war. But apparently the time's up for the turf war. To be distracted by the fact that we're not getting support to do a vaccine program because the government has decided not to fund it, I think while it's important and remembering that GPs weren't funded in the 90s when I started in this program. My view is that Australia's got an issue with population health programs. Our breast screening programs are 55%, and I think that's because they're done through government. They're not including providers and people on the ground who could actually get the numbers up. Our bowel cancer screening rates are around 60%. Our lung cancer screening rates are probably going to be low because we don't engage healthcare providers and communities on the ground to get involved. So I think it's important to concentrate on population health programs that involve everyone and everyone who can, and actually support ways to do that. I could give you all the arguments for and against for why doctors should do it and why pharmacists shouldn't. But I think misinformation with pharmacists say you can't see a GP. Most GPs will bulk bill and won't charge it. But, is that a fight you want to have? If you give it early in the year, is that because you've got access to a vaccine, or is that a turf war with someone saying it? So let's not concentrate on those issues. Let's concentrate on actually getting support for anyone who's doing vaccines and recognising it. And I appreciate the frustration because I spent 25, 30 years in this space understanding the frustrations, but the first involvement of GPs and actually this meeting, which was first held, I think John Litt and a few of us who were at the PHAA meetings back in the turn of the century, GPs weren't even mentioned. The PHAA didn't acknowledge that GPs were part of a primary healthcare program, and we had to infiltrate and get our general practice as part of their wish list to involve them in programs. So 25 years ago, GPs weren't included. Now there's other people who aren't being included in the mainstream. Bring everyone in and let's vaccinate as best we can. But remember, at the moment, we're all failing because the numbers are going down. So let's concentrate on that.
It's a public health response. It's not a he or she said.
So all I would add is it's not a turf war. We're all on the same side. So, we all work in different areas. As my presentation said, we need to think out the box. I would say that nurse practitioners can prescribe and give vaccinations.
They can, but they can't set up their own clinics.
So I have my
Angela.
own clinic.
Maybe this is in
SA
government.
Health. So
But
this
can
is
I make a comment in terms of your prescribing? RNs prescribing, they cannot prescribe yet.
Not yet.
No.
There's
That's
a new
changing.
course.
And
So-
it's not prescribing and diagnostics like nurse practitioners. It's just re-prescribing.
Yeah. I would say that I can prescribe every vaccination except for COVID. So in my clinic, which is a nurse practitioner clinic, a massive barrier for me is I can't access COVID vaccines. Whereas I walk up the road and work in the GP clinic, and I have given thousands and thousands of COVID vaccines. So there is a way around, but COVID is quite unique.